Well, good evening. Good evening, everybody. My name's Mark Littlewood. I'm the Director General here at the Institute of Economic Affairs. Thank you very much for joining us on YouTube for this live episode of IEA Isolation, in which we'll be considering various aspects of the lockdown, the science around it, the economics around it, and the liberties around it. And of course, we're always told that we must be guided by the science. That's become one of the memes of recent times. And we've got three fantastic guests with us tonight, all of a very scientific and rational mind. So as far as the science, the economics and liberties around coronavirus are concerned, I'm pretty confident we can knock the whole thing on the head in the course of the next 45 minutes or an hour. Shouldn't really be a problem at all. I'm joined this evening by the IEA's very own Chris Snowdon, our head of lifestyle economics here at the IEA. He's written several books and dozens of reports on civil liberties and the nanny state. Good evening to you, Chris.
Hello, how are you doing?
I'm also delighted to be joined by Thomas Whipple, the science editor at The Times, author of several books about science, including one coming out in September, titled A Little Light, 20 Ways the Coronavirus Response Could Make the World Better. Interesting to hear some of those 20 ways, if you can reveal anything about those to us, Tom. But of course, the proudest and greatest element of Tom's life is he's my first cousin, a badge he wears with pride, morning, noon and night, I know. And last, but by no means least, we're joined by Paul Ormerod. He's an economist, partner of Volterra Partners Consultancy, a visiting professor in the Centre for Decision Making at UCL. Paul also argued in a new briefing paper for the IEA entitled Model Behaviour, and we'll put a link to that in the YouTube chat, that economists should help play a vital role in easing the lockdown. Gents, thank you all for joining us. Great to see you all. As I said, I'm pretty confident we can solve all this in the next, 52 minutes or so, can't we? So I wanted to start, Tom, you've written in today's Times about the whole face mask issue. What's the science behind this, and how settled is it that we know whether these are good for us, good for our fellow passengers or the people around us? And of course, they're going to be compulsory on public transport from June the 15th, I believe.
Yeah, I think that face masks are slightly a paradigm for how the science has gone in a lot of this, in that the honest truth is we really, really don't know. We came into this, and I guess the settled position, the consensus view of scientists coming into this pandemic in Britain was we don't have randomized trials that show that face masks work. We have concerns that if you wear face masks, you're in some ways going to be more reckless with the virus because you'll think you're protected. And all of that's true. We really, really don't have evidence. There was a review in the Lancet last week which tried to assess where we were, and it concluded that, so two conclusions. One was that it is possible that they very significantly affect transmission. But it also said we have very low certainty of that. Basically, you can't tell if the sort of person who wears a mask is also the sort of person who washes their hands regularly, avoids contact, all these other things, because we haven't done the trials. So that was a settled science, but slightly there's been this other strand coming through which says, hang on, yes, you're right, we don't have these gold standard trials. On the other hand, if I sneeze, I put my hand over my mouth. Don't you think it might be sensible to apply that same principle to this? We understand the physics. We know that these aren't going to make things worse. They're likely to stop something. And in terms of what they do, there is a new consensus forming that probably they prevent you from transmitting it quite so much. They quite possibly don't have as much effect on your own likelihood of getting caught. So it's a slightly altruistic act.
Okay, yeah, so kind of other regarding action insofar as we can see it. But Chris, your thoughts on this? Because again, politicians are all sort of suggesting that all of their actions are going to be settled by the science, as if there's no politics in this at all. And even on something that you would think is as straightforward as face masks, it seems there's as many different opinions as there are scientists, and as much different and conflicting advice as you could possibly not hope for. On the one hand, they don't do anything. On the other hand, you must wear them. What's your take on the science around face masks, or is it just completely unknowable?
I basically agree with what Tom says, but it's the kind of thing that's very, very difficult to prove in a randomized control trial. And so you have to just use a little bit of common sense, maybe you want to call it that. But it's more than common sense. There's an obvious biological mechanism by which not sneezing at people is going to, reduce their risk of catching an infection. I think that everybody realized when the government said that it was advising against the use of face masks by the general public in everyday situations, that it was because there was a worldwide shortage of face masks and that the NHS wanted as many as possible so that doctors and nurses didn't run short. I think people also realized that face masks worked, which is why doctors and nurses need them in the first place. It didn't take a rocket scientist to work out what was going on. And if the government had been straight with us about that, I think people would have understood. I think you could probably, even as a libertarian, justify some sort of emergency ban on the sale of face masks to the general public if there's such a shortage that medics really can't get their hands on them. So I think most people realized what was going on. We saw it also in other countries where the US Surgeon General went from saying, do not buy face masks under any circumstances, to within a couple of weeks saying you should wear a face mask, to cities saying you must wear one under certain circumstances. Yeah. So as with a lot of things with this pandemic, we're only following the rest of the world with a month or two's lag. And so whilst I can understand why that initial advice was there, I don't think the government needed to go so far as to actually ban adverts saying that face masks work. We had the NHS medical director accusing a company of being callous for trying to sell face masks. We had Public Health England accusing companies of exploiting the situation and causing alarm by suggesting that wearing a face mask might be a sensible thing. This is such a reverse spirit when you start persecuting people for promoting the use of face masks, actively discouraging people from using,
and then make them compulsory,
and then making them compulsory. Yeah, so it's classic.
And that's all in the period of what, 5 weeks or something? I mean, it's
3 months, I guess. I think the Advertising Standards Agency ruling on the adverts was early March. So just 3 months.
Paul, what do you make of this? You're saying that the economists need to be more involved. Do the scientists really know which way's up?
Economists do use randomized controlled trials. In fact, last year's Nobel Prize was given to somebody who'd pioneered the use in economics. But we're used to drawing evidence in many different ways, and we don't necessarily rely on a single methodology like that. And so I did write a paper with Jerry Lyons. He's a prominent Brexiteer economist in early April, talking about exit from lockdown. And then we advocated in that the wearing of face masks in a compulsory way on public transport, in public gatherings, because the evidence seemed to support it, that it was established by the science during March that the main way the virus was transmitted was through droplets from the mouth and nose. And so it made sense for people to cover up. And we made the point that apart from medical staff and people like that, the main purpose was not to protect you, it was to protect other people from you. And we also looked at evidence from countries like South Korea and the Czech Republic, which did have face mask wearing as compulsory, and they seem to be doing better. So that's how economists put together evidence. We don't necessarily, as I say, rely on just a single methodology.
No, sure. Tom, let me come back to you, because what I'm interested in here is some of the morality of this, not just the science. I mean, obviously, science is uncertain. It's a continual discovery process. I wasn't expecting you to be able to tell me that wearing this face mask will reduce your risk of getting COVID-19 by 82.7% or whatever. You can't really do that. But making it compulsory, that's quite a step, right? Given that as Chris was just saying, that, only a few weeks ago, we were sort of saying, these are useless. And in fact, you're being an exploitative capitalist bastard if you try and sell them to people. So you must now wear this on the London Underground or you will be fined. I mean, come on. If the science is that uncertain, shouldn't we be much more in the area of guidance and admitting to people this is just our best guess, rather than expounding with certainty whatever the latest fad is.
I think one of the things we need to be a lot clearer about in this, and perhaps we have been, is that the entire thing exists amid this miasma of uncertainty. I mean, maybe the reason they've sort of combated the evil capitalist bastards is because there's so many YouTube footage videos showing you can now make these with your socks. I think the compulsion aspect is because of the fact this probably isn't for you. This isn't about you taking on a risk for yourself. I think there's a genuine fear that we've all seen the footage of tube trains and the idea that they're maintaining social distancing in the tube train, or even what it means in this train where you've got circulating air that it's not getting out of the carriage. What does 2 meters even mean? Mm-hmm. I think within that context, there's a real fear that you could end up with a single super spreader event just on one trip on the Jubilee line. And in that case, this is something that basically doesn't have a downside. We've got all of these theoretical concerns about people taking more risks because they've got it on, or touching their face more, or all of these other things. But there's a low downside. There's a possible upside. I think it makes sense. I think it also makes sense if we're going to make arguments about people. If you've got a mask, maybe you'll take more risks. I think actually it's more plausible if you know you have to wear a mask to go on the Jubilee line. You may be more aware continually about the threat of this virus whilst you're on the Jubilee line and going about your normal life.
Yeah, these psychological things, Tom, let me come back to you on this, are fascinating. I mean, I think I'm right in saying that there was a study some years ago that sort of reached the conclusion that perhaps the best road safety device would be a massive spear sticking out of the steering column, poised right at the heart of the driver, far better than an airbag, because you're not likely to take a corner at 60 miles an hour if you've got, so you get those sometimes those really perverse effects behaviorally. But my question would be this, which goes more to the politics, the morality of it, is, okay, let's say the balance of evidence is it modestly lowers the risk of you spreading it on the Jubilee line. Why are we only applying this to COVID-19? I mean, lots of people get a bout of the sniffles in November. Seasonal flu comes round every year. I mean, let's make face masks compulsory in public forever. And that might help us combat COVID-19, but it will generally help us combat the common cold as well, won't it?
I think you've hit on something, probably the opposite point that you were trying to make. Is I think you make a reasonable case. Before this, we used to sort of accept that, I could meet you for a pint and you'd give me a cold that could lay me down for 3 days. I mean, if that was in the context of you deciding to have a fight with me, that would be actual bodily harm. But in the cold, we put up with this. Now, I'm not remotely saying that there should be an actual legal compulsion to avoid that, or that one should prosecute in the way that you would with a fight. But I do think we should maybe re-examine our social norms after this and think, you know what, maybe we should be more careful. Maybe we should stop laughing at people in Southeast Asia who go around with these masks whenever they're ill, because it's not a nice thing to give someone even a cold.
No, sure. I mean, I guess in terms of meeting a friend or a family member for a drink, Tom, though, it's the kind of, there's mutual consent. I mean, it's more like, it's not really grievous bodily harm, is it? It's more like a boxing match. And I can tell the viewers that going for a drink with you is very much like going to a boxing match. But Chris, where do you stand on this compulsion point? And I also would be intrigued to know what other flights and fancies there are of science going out there, in particular, where we've got to on the latest evidence around nicotine.
Oh, well, there's big issues there. Well, let's start with the nicotine. So as some viewers may know, I don't know if it's been reported in the Times yet, Tom, but it seems that smokers are less susceptible to be infected with the virus, seems to be, in my reading of the evidence. Initially, there was talk of it, smoking or nicotine, helping people fight off the most severe symptoms because smokers were heavily underrepresented in China and elsewhere in coronavirus wards. And that has been the case in Britain too. And I've been quite skeptical. I've got a huge amount of confirmation bias in wanting this to be true, but I am still actually quite skeptical about it, because unless you adjust for age, it doesn't tell you a great deal. If you've got, 8% of coronavirus patients are smokers and 25% of the general public smokers, it doesn't tell you a great deal. In Britain, the over 65s only have a smoking rate of 8%. However, there have been several epidemiological studies now, at least half a dozen, which have adjusted for age and other factors, and have still found smokers to be about half as likely to test positive for COVID. There are, I am told, plausible biological mechanisms by which this could take place, to do with ACE2 receptors and things I don't really pretend to understand. And there are, I'm told, also experiments, randomized control trials going ahead in France with coronavirus patients and nicotine patches to get to the bottom of it, but they haven't yet reported their findings. So we've heard a lot in the last week about how certain ethnic minorities are much more likely to suffer from coronavirus, how obese people are much more likely to suffer from coronavirus. But Public Health England's report about all these different risk factors was probably the first Public Health England report about risk factors for any disease that didn't even mention smoking at any stage. And of course, they still advise people to not smoke, of course. And initially, they said that smokers were 14 times more likely to suffer severe symptoms for coronavirus, based on a tiny study from China that involved just 5 smokers, 3 of whom developed severe conditions. So that's the kind of rubbish that Public Health England is quite happy to cite as serious evidence. So we don't know, and it's a shame that people aren't taking it more seriously, because it is quite plausible. Not so much smoking, but probably nicotine does have some kind of beneficial effect here.
I just love the idea that perhaps in a few weeks' time on the Jubilee line, it will be compulsory to wear a face mask and compulsory to smoke cigarettes in order to try and lower
quite a difficult combination.
Yeah. No, we might have to redesign the face masks to make that possible. Paul, what are your thoughts on this and how we navigate our way through these uncertainties?
On the compulsion part, I mean, there's classic economic arguments for regulation when there are market failures, when there are, in this case, there are externalities. Mm-hmm. So your behavior causes, it has effects external and impacts on other people. So there are classic arguments to be able to regulate in this area. I think the question of whether it should become more compulsory to prevent the spread of flu and colds is quite interesting. But I would say, again, looking at it from an economics perspective, I'd invoke another concept in economic theory, a very important one, that we really discover what people think by what they do, rather than what they say in surveys. They reveal their preferences by their actions. And people feel quite comfortable in accepting the risks of flu and colds and not putting up with the inconveniences of compulsory mask wearing. I think the difference with the COVID virus is the great uncertainty around it. We know a lot more now, but it's also well established in behavioral economics that people really dislike ambiguity and uncertainty. They actively dislike it. And so in these, it's a different circumstance from well understood viruses like flu and the common cold. So we just need this to be out of the way and get back to normality as quickly as possible.
Paul, is there any chance, though, that we could, I mean, maybe not perfectly, but effectively just make this a property rights question? I mean, I can imagine one chain of cinemas will insist that you wear face masks. Another chain of cinemas might insist that you don't. I mean, the club that I'm a member of on Pall Mall used to insist that you wear a tie. It no longer does. I mean, can't we just... Now, I appreciate that the London Underground, you couldn't have a different rule at St James's Park to Westminster.
You know, if you're saying you're offering a choice to consumers where there's competition in the market, you could say, well, you know, why not? You know, I can't remember which football team you support now, but I think you quite fervently support one. You know, but
Southampton,
we could test it out and see. You know, and their rivals would have the bitter rivals would have a different policy, and we could do like a randomised control trial on that.
Yeah, keener to kind of test things out on Portsmouth rather than Southampton, really, myself. But I mean, Tom, what's your view on the compulsion point, and
Well,
how far would you take it?
I
And
mean,
could we
okay.
do it on property rights? I mean, you could have a London cabbie who says, "I'll only let you get in the back of my cab if you're wearing a full hazmat suit." We'll see how much business he picks up, right?
Well, yeah. I mean, the issue is that it's not just a question of the people going to your cinema chain. I am invested in the entire country not having a coronavirus outbreak, and the secondary infections from the people who've been to your libertarian casual coronavirus cinema chain will itself restart the entire epidemic. So I think this is a classic example where personal choice actually can't come into lots of things, because we rise or we fall as a herd.
So you actually think in economic terms there's a kind of collective action problem rather than an externalities problem, Tom, right? I mean, that we've got to all agree some broadly common standards. It's not very easy for me to be extremely risky and you to be highly risk adverse.
I mean, well, that's the entire thing, because I'm not, I'm under 40, I'm reasonably good health. This is not a concern to me. I mean, the entire thing.
You don't smoke though, so you've got some risk.
I have not saved myself that particular risk factor, but basically I'm fine. And the reason we're doing all of this is for people in the sort of upper age groups. It is already that.
Chris, you wanted to come back in.
Well, only to say that it's kind of the question of whether we force people to wear masks on the tube is a microcosm of the greater conflict between sort of risk and liberty that we're dealing with the whole lockdown. I wrote a piece several weeks before the lockdown began saying that libertarians don't necessarily have any problem with even very stringent measures like a lockdown on John Stuart Mill harm principle grounds. But now I'm really very frustrated with the lockdown and how long it's taking to be relaxed. And why is that? Well, it's because we can never live in a risk-free society. I mean, for one thing, the lockdown was sold to us on the basis of protecting the NHS, and the NHS clearly hasn't been overwhelmed and is not likely to be overwhelmed. But now we are being asked, anybody who wants to return to any semblance of normality, the onus suddenly is on us to prove that there is no extra risk from allowing people to congregate outdoors in more than 3 or 4 people, or to allow a handful of school children to go back to school. And of course, you can't do that because there are inherent risks. I think we'll probably come on to this. I don't think there are great risks from opening schools, but it's not impossible. I can't prove that no teachers are ever going to get infected by a child. And yet we cannot live in lockdown forever. Just as it would probably be extreme to force people to wear face masks to prevent the common cold, it is extreme to have a total lockdown of society and the economy for 11 weeks and counting in order to prevent more people, average age 84, from dying from coronavirus.
Paul, let me come back to you on that with your Economist take on it. Have we just completely failed to understand the concept of a trade-off in the policies that we're making here?
Oh, absolutely. I think this is a fundamental point. I think I'm pleased. I mean, this is entering more into public consciousness. That for example, by having a lockdown and diverting resources in the NHS to COVID, then people with other diseases are dying. People are not getting treatment. Or we could think of it in a concrete way. I mean, it's not a fatal thing, but if somebody says waiting for a hip replacement, then I know these people are in, huge pain, every single day of their lives. And hip replacement transforms the quality of their lives, and these things aren't happening. So yeah, I think I agree with Chris that we've rather lost the plot on this and focusing just on one aspect, rather than taking account there are broad trade-offs. And we'll see what happens when it's more relaxed and the economy gets back to normal. When the Chancellor's schemes start to end, how many people are unemployed? What's actually happened to the economy? But yeah, I mean, trade-offs are really fundamental to absolutely everything, and people have really lost sight of that.
And Paul, do you worry a bit? I mean, I guess this is more a political question than an economic question, but that, if you like, the scale of huge government intervention to deal with a problem could go up if people aren't furious about what's happened on COVID-19. I mean, imagine a very severe bout of seasonal flu. Would there be a case for bringing in some level of lockdown measures to cope with that? You know, will it sort of be, well, if we did it for COVID-19, let's do it for X, Y, or Z, whatever particular threat
Well, and
happens
I
to
agree.
emerge
I
on the horizon.
think there is a risk, but we have to say, put it in perspective. And this was something, really completely different. We hadn't been exposed to a major pandemic in the West, for 100 years.
Mm-hmm.
And so it really was exceptional circumstances. And I think that's the point that's got to be hammered home. It's only in exceptional circumstances. I suppose we take the Second World War, when the state had to play a major role. It's only in circumstances like this that you rely on heavy state intervention. And when you get back to normal, a definition of normal is that the state plays much less role than it does during a crisis.
Sure. Tom, let me come to you. Let's move on to this schools issue, because my opinion for anybody who cares about it would be, I don't think we're liberalising lockdown anything like rapidly enough. But schools is an area where we've started to liberalise this week in certain chunks. What's the science behind that? Is this at least an uncontested point, or is this as complex as face masks and nicotine and what the protocol is on the Jubilee line?
I think it's almost as complex. It's getting less so. So there are three. I'd break it into three sections. So the first is, are children at risk? And the quality of evidence on this is pretty good. Children aren't at risk. There's this Kawasaki syndrome that people are talking about that seems to be about 100 cases of this syndrome we don't understand being instigated. But that's something slightly separate. In terms of deaths, to all intents and purposes, children don't get it. This is literally one of these situations where you can say, without hyperbole, that the walk to school is a lot more dangerous than being in school itself. So that's the first bit. The second bit is, can children get it? And the evidence has been coming in slower on that. It looks like they probably do get it, they're just not symptomatic, but they probably get it at about half the rate, or that sort of order of magnitude rate of adults. And then the third thing, where the quality of evidence is lowest, is can they pass it on? And that is sort of the crucial one, because we're not talking about their own safety. We're saying, is this sort of place where people get together and sniffle and wipe snot on each other and is generally the perfect incubator for disease? Is it going to continue to be the perfect incubator for disease? And if I was to hazard a guess and say with massive confidence bars on it, I would say that children can pass it on. They wouldn't test positive if they can't, because if you test positive, then you're shedding the virus. They probably pass it on a fair bit less than adults. And reopening schools was the right thing to do, and to see what happens, but it comes with uncertainty. But the final thing I'd add on that is, my son went back on Wednesday for the first time, and there were 26 kids in the school, and it seems to be set up to just about take 26 kids now. They have to line up in the playground, it's all separated. There is no way that I can see, with the measures we currently have, that you're going to get close to reopening schools properly.
I just want to clarify, there's 26 kids in the school because 1,500 aren't turning up, or because it's a very small school?
It is a relatively big school. You'll press me on the numbers. I think it's probably about 500 kids. They've opened the bottom year group,
right,
which just happens to be what one of my sons is in. And a portion of them come, but there's 10 kids per class. This is not a sustainable way of keeping school open.
Chris, what's your take on the science of schools, the policy on schools? And of course, if you don't reopen the schools, it makes it that harder to move the further dominoes down of getting parents back to work and the like.
Yeah, it makes it almost impossible to get things back to normal in terms of adults working, which is actually why the SAGE committee and behavioural scientists in particular were really quite reluctant, and even Neil Ferguson actually were very reluctant to include it as part of a lockdown. And until very recently, in the path of the pandemic, it was pretty uncontroversial keeping the schools open. I think we closed them because we panicked in such a big way. We've panicked since by bringing in these ridiculous social distancing measures, which means that schools will never really be open properly, so long as we've got this 2-meter rule, which is not very scientific at all, as well. And it takes me back to my previous point. People like me have to now prove that it can never be transmitted in schools. I find it very interesting what Tom was saying. It's amazing to me that we haven't got more evidence on whether kids can even catch it or transmit it yet. But one thing we do know is that the schools were open, and kids obviously do not naturally socially distance. They were open for a very long time before the lockdown, and the rate of infection amongst teachers is below average, which I think is surely pretty telling. And the schools have been open around the rest of Europe and most of the world for quite a long time. And there hasn't been a second wave. Lockdown cucks like Sam Bowman will point to Israel closing down a few schools or France closing down a few schools. Well, yeah, I'm not promising, obviously, that no teacher will ever get coronavirus. And if a teacher gets a coronavirus, you've got to then close down the school because the rest of the teachers have to go into self-isolation. That is not the same thing as a second wave starting as a result of children transmitting COVID.
Paul, what's your take on the sort of schools policy here? And I see David Middleton's asked on YouTube, and this goes again to the sort of behavioural element, the psychological element. Surely reducing the social distance from 2 yards to 1 would be a worthwhile gamble in terms of making the trade-off. So I'd be interested to know about schools, whether you think that change would change things. Although going back to what we were saying earlier, might it be that if you tell people it needs to be 2 meters, they actually practice 1 meter, and if you tell people that it needs to be 1 meter, they actually practice 30 centimeters? It's like speed limits. Everyone on the motorway will always drive 7 miles faster than the speed limit, whatever the speed limit is.
Well, I agree with Chris. I think that schools shouldn't have been closed, and they should now open completely normally. I mean, you have to be very careful with the evidence from epidemiological models, but there's quite a number of studies around the world in different countries suggesting that the impact of closing schools on the spread of the virus was very weak. There's no real study suggests it has a powerful effect. And on that reason alone, I think we should have essentially kept them open. They should open normally now. Again, it comes back to this question of trade-offs, so there is some risk. And again, my more general fear, I think we should, rather hinting at before, is that we've been moving more and more into a culture obsessed with risk and health and safety. And one of the potentially serious consequences of this crisis is that it'll be hard to. It's actually given that culture a boost, where the evidence on schools, as everybody said, is that there's no real reason, there's no strong reason to keep them anything other than open as normal.
Mm-hmm. Paul, let me turn to your recent briefing paper for the IEA. And again, one of my colleagues will send a link to that in the YouTube chat. In that, and I'd like you to expand on this thought, you say the Behavioural Insights team appears to have given advice that lockdown would only be effective for a month or two at most. The population would react against it. The only policy open to the government was therefore one of letting herd immunity develop. Can you expand on that a bit?
Well, I mean, we don't know for certain because a lot of this is behind closed doors, but it's certainly been reported at the time. When it goes back to this idea of, remember in mid-March, I mean, it seems many years ago now, when people were saying, oh, well, we should develop herd immunity, we shouldn't really do anything, we just should let the virus spread. And it's believed that one of the arguments put within Downing Street was by the Behavioural Insights team saying there's no real evidence that lockdowns could persist and people will start to break them. But on the contrary, if you think about it from not from a behavioural economics point of view, purely classical rationality, if people feel that there's a serious risk to their health, they will actually take steps. And we could see in the week when it was advisory, that week of the 16th of March to 23rd, there's a lot of evidence that behaviour changed dramatically. I mean, offices were closed, traffic was down, and the spread of respiratory diseases in general fell quite sharply. I think the Centre for Evidence-Based Medicine at Oxford have shown this very clearly.
Mm-hmm. No, I can testify to that anecdotally. I was about the last man standing in Westminster. I mean, the the local pub that I and other members of the IEA regularly drink at, which is packed on Thursdays and Fridays. I mean, I practically had it all to myself that Thursday night. Could have self-isolated there for the duration. Perfectly safe place to be because nobody else was there. Tom, what do you make of this, and how politicians are sort of second guessing, having to guess at what sort of behaviours people will take? We obviously had all this stuff about Dominic Cummings, given he's breaking the rules, will everybody now think that they can break the rules? I think that was more of a media farrago than any evidence that they were. But how do you think politicians, public policymakers should approach these issues of trying to judge human behaviour and reaction to these sort of things?
I mean, it's obviously extremely hard to do. I think if you had told us 6 months ago that we would be doing what we're doing now, I think few of us would believe it. I, in fact, read a book about pandemics by a mathematical epidemiologist who talked about how the only way to stop them would be to, these days, lock down an entire society, but obviously we can't do that. So I don't find it surprising that they were advising that. But there was a lot of advice. If you read through the SAGE minutes, or I've chatted now to a lot of people on and off the record who are on SAGE committees, and done so throughout the pandemic. And this has slightly become a cultural touchstone that we've got, the lockdown skeptics and the lockdown absolutists. If you chat to people like Jeremy Farrar, the head of Welcome, right from the beginning, he was saying that we are very, very worried about doing this policy. We know generally that there's obviously all of these economic trade-offs. There's also health trade-offs. He talks about how during the Ebola pandemic, when they had a lockdown, more people died of measles than died of Ebola because they weren't able to get treatment. There's been a lot of people considering these things, and this was not something that was gone into lightly. Or with certainty. And I think the area where there'd be the least certainty would certainly be with the behavioural insights team.
Okay, Chris, what do you make of the reliability of the behavioural insights team?
I'm not too impressed. I mean, like Tom, I've read through all the minutes and all the documents at SAGE, and one of the things that really comes through to me was that the behavioural insights team were just making it up as they went. There didn't seem to me any real difference between their advice and the kind of advice you would get from some slightly above average people in a pub. It was there were hunches, and some of the hunches were wrong. They were convinced that people would never put up with a lockdown. They were against closing down things like football matches because they just said, well, people only congregate in the pub. Didn't seem to contemplate the possibility that maybe the government would close down pubs as well. So it was off the hoof advice, a lot of it. But I think the really important point, which may well get lost as history is rewritten, is that the original policy that's been come to known as herd immunity was the scientist advice, just as it has been in Sweden, where they've actually pursued basically that strategy. It was not in any way Dominic Cummings' idea or Boris Johnson's idea. It was the original scientific idea. And whether you agree with that or disagree with it, and I'm a bit halfway between the two in a way, it was a serious strategy. I think maybe if you're going to point blame, you can say that Public Health England and like-minded organisations were planning for a flu epidemic. If you look at the documents going back years, they've been planning for a big major flu epidemic, and they just kind of cut and pasted the strategy for dealing with that and applied it to this. And this turned out actually to be a lot more unpleasant and a lot more lethal. And so perhaps it was wrong. But that doesn't mean the lockdown was right. And the idea that the scientists then suddenly forced their hand in mid-March and demanded the government bring about a lockdown is simply not true. Even Neil Ferguson's model does not look at a total lockdown. It looks at pretty heavy social distancing, but not a lockdown. They still expected people to go to work, for example, which implied that people were still going to go to school. So history's been rewritten in a rather dodgy way. There's a lot of arse covering going on now from various people because now the consensus view is lockdown was correct. Actually, I think Sweden had a better idea, and I think in time we'll probably see that Sweden had a better idea.
Yeah, and I know you're a lockdown skeptic now, Chris, as the sort of evidence rolled in. I wonder for market liberals like you and I, whether we could have overcome the collective action problem. Let's just say, and I know this is contested, that you need 60% of the population to have got it and recovered from it, and you've got herd immunity. Couldn't we have had a way of paying young, healthy people to get it while we put the older, more frail people or asthmatics, behind closed doors, could be an economic trade to get us
in
to
a
herd
way, that's
immunity.
what happens if you have a free market. If we hadn't furloughed people would have to go out and work if they wanted money. And it would be, by definition, working age people doing that. We should have cocooned people. To be fair to Bagel Insights people, what's he's called? David Halpern, the guy who runs the Bagel Insights group. He got a whole load of abuse on social media in late February, early March for proposing that, really, saying, well, this is going to be a long project. This is going to probably take 12 weeks, but we cocoon the vulnerable and we allow everybody else to get it and build up herd immunity amongst young people. However, at the same time, some of the other behavioral scientists were saying in the SAGE meetings that the old people will never put up with it. It's got to be all or nothing. There was a lot of really bad advice, as I say, not really based on any evidence, that were undermining things that were actually pretty commonsensical. Same as wearing a face covering is pretty commonsensical. They're going, well, we haven't really got the evidence,
Yeah. Paul, let me bring you back in. There's a couple of questions and comments that have come up on YouTube. And I'd like your thoughts on whether a market discovery process could have actually found the solution to what appears on the face of it to be a collective action problem. But maybe there would have been, if we allowed people to go about their ordinary business, we would have got by beautiful Hayekian spontaneous order to a better outcome earlier. But the also asked on the 2 points made on YouTube, Ian Pitchford asked, so many failures by so many institutions, what's the common element? And somebody else asks whether the differences between Scotland, England, Wales and Northern Ireland have shown devolution to be a bad idea. Do you actually think there should have been more, and should even now be more, experimentation as we're embarking on this sort of discovery process? And had we allowed more liberalism, might spontaneous of order have found the solution?
Well, we've got a lot of experimentation with different countries around the world, and that's where the evidence is coming from. We don't need randomized controlled trials. We just look and see what's happened, and some general consensuses are coming out of it. I'm going back. I can see why at the time the government felt it had to impose lockdown. If we think of the circumstances, that it appeared from data from China that the death rate was really quite high, 3-4%. Those are the initial data that was coming out. We saw on our television screens that the North Italian health service being overwhelmed. So politicians in those circumstances, what would you reasonably do? You can't say, as a politician, I'm going to sit there and let a Hayekian experiment take place. I've got to
alas.
If I get it wrong, I'm out at the next election. So you can see why they did it, and they rushed into it with no idea how to get out of it.
Tom, you're going to be more sceptical that sort of spontaneous voluntary action could have got us to a better outcome. What's your view there of how Sweden has applied its laws? And I do want to ask you, in fact, I'll go around all three of you and ask this. I mean, do you think, Tom, that we're now easing the lockdown too rapidly, not rapidly enough, or have the government got the Goldilocks sweet spot just right?
I will, at the risk of being labelled a lockdown absolutist, I think we're easing it a little bit too rapidly. Let's leave aside some of the others we've heard so far. There was a purpose to this lockdown, which was to completely stamp out the disease so that we could cope with it, hopefully with a test and trace strategy and some sort of intermediary until we get a vaccine. It feels to me like the pressure to lift the lockdown is the thing that's driving the lifting of the lockdown, rather than the position of being in the position where actually that strategy makes sense, where we have few enough cases where the R is far enough below 1 that we can do it. So from that point of view, I think we're probably lifting too early, although I do think schools was probably right, if only because we've got the summer holidays to see what happens. But I mean, I don't know, I have tremendous sympathy for the government in what it was trying to do. A counterpoint to Sweden is we've had 60,000 deaths and we have had a really big lockdown. How many more deaths would have been acceptable or unacceptable? The danger with all of these country comparisons is there's so much we don't understand. Why did the north of Italy get it really badly, whereas Sicily was fine? Why did New York get it really badly, whereas Florida, which is where old people go to die, is where the old people didn't die? There's so many variables that we don't really have a clue about, except that unless we've got everything wrong on germ theory, we do know it depends on people meeting each other.
No, that's right. And there's also very difficult comparisons, isn't there? I mean, for example, I gather that Sweden has pretty much the highest proportion of single occupancy households anywhere in the Western world. So quite irrespective of the policy, just that demographic feature will have an impact. And other countries where, 15 members of the family tend to all live in a big house rather than each individually living in a small house. So it's quite difficult to compare exact like for like, I guess. Chris, you're now on the end of the spectrum, aren't you? Full-blown lockdown skeptic. Call a halt to this now.
Not full-blown, but I like to be somewhere nearer to where Sweden is. And there were two stories this week, both of which were rather misleadingly reported. One, Neil Ferguson was alleged to have said that that basically Sweden got it right. He didn't say that, but he did admit that Sweden did a lot better than he expected them to, given that they didn't have a lockdown. And Anders Tegnell, who's the Swedish epidemiologist, was quoted as saying that Sweden got it all wrong and they should have had a lockdown. He didn't say that either. Actually, he just said there are one or two things we would have done differently, like protecting care homes. And I think that's about right. I think Sweden plus, as it were, would have been the best way to do it, because Sweden's health system has not collapsed. I don't really accept Tom's view that this virus can be stamped out. I'm much more in favor of the old herd immunity view, which said that this is not going to go away without a vaccine. We've got to accept that people are going to die. Fortunately, the average age of people who do die is 84. And it's going to be a problem for a long time, but that's just the way it is. We're in week 11 of lockdown. The economic damage is off the chart, absolutely off the chart. It's quite probable that the lockdown is killing more people than it's saving. We don't know yet, but it's certainly going to have huge economic damage once those redundancy letters start going through the post. We can't, it should be obvious that we cannot continue like this. We can't keep going. It's 11 weeks. If we haven't stamped it out after 11 weeks, we're not going to. People are kind of ignoring it anyway, most obviously in Hyde Park this week. So Sweden has shown that you can deal with this without totally destroying your economy, without being incredibly illiberal, and your health system can survive. So I think that's the way we've got to be. Sure. We've got to be moving in that direction. And I don't agree also, just quickly, that we're relaxing it too fast. We're not doing anything. We're just letting a few people go outside. We're allowing outdoor car showrooms, outdoor markets, and we're trying to get a handful of kids into primary schools. I really don't think that is acting quickly after 11 weeks.
Premier League back in 10 days' time, near as damn it.
Well, let's talk about Belarus. Everyone talks about Sweden. I'm
Belarus,
Mark, a big fan of the Belarusian Football League.
Chris has become an addict to the Belarusian Premier League,
where they still have fans. They still have fans.
Yep.
One or two of them are wearing masks, but they're still out there. The official statistics suggest they're having. Indeed, it is. Yeah, like Nicaragua.
Shows how far we've fallen. Paul, let me.
Well, it hasn't been a catastrophe.
I think although I support the idea of bringing a lockdown, like I said, I think the government really had no choice. But I think although as Tom says, there's a lot yet to be discovered. But on the other hand, we know an enormous amount more than we did in the middle of March, and people have got much more information about whether they themselves are vulnerable. And so I think in these circumstances, we can legitimately relax lockdown faster, and people can then make their own choices. It's not as though, like I say, in the middle of March, we thought we were confronted with a disease that killed 3 or 4% of the population. And it's clear it doesn't do that. And it's clear that there are large chunks who really have virtually no deaths. And it's concentrated among certain groups. So in those circumstances, I think it's legitimate for people to make their own decisions, as they did in Sweden.
And Paul, do you think on that, the big information that's come to light is the fatality rate and the age demographic? I can't remember the numbers now. And of course, there'll be some tragic exceptions. Well, no, I think it's not so much people under the age of 50 who are basically healthy aren't really dying of this, right?
Partly the age demographics, but it's also pointing out, if you're very obese, you're at risk. If you've got a serious cardiovascular problem, you're at risk. And this is now well known, this is well publicized. And so, under these circumstances, people who suffer from these conditions will be well advised to maintain their own personal lockdowns. So it's partly, one point, I'm not sure you're going to come onto this, was what I see going back to the discussions around the behavioural insights team, but more generally, has been a massive failure of the public sector bureaucracy and the scientific advice the government's received. We've touched on the fact that the government were given advice that there was no need to ban mass gatherings. Well, that was challenged even at the time, and elementary logic suggests, even at Southampton, there's a big enough crowd to spread the virus, to many, many people as you move around it. And we've got the scandal of people being dumped from hospitals on the instructions of the Care Quality Commission into care homes. And for me, that's one of the striking features, has been the failure of the British public sector bureaucracy in this.
Tom, let me come to you on that as our token defender of the public sector bureaucracy on this evening's broadcast. What I'm interested in here, though, is, we've talked a lot about the science and the unpredictability of it, but as Paul says, there's a lot more information to go on. 3 months ago, I was utterly terrified because I'm an asthmatic. As of a few weeks ago, I was much more relaxed because I've been a heavy smoker for 30 years. It's pretty strange how things affect your risk profiles, right? But when we get out the other side of this, the optimistic side of my brain says, however ghastly it's been, at the very least, there will be, if we're objective, a lot of really useful lessons to learn. We will be able to go through and work out which healthcare system in Europe was the fastest at producing ventilators, or the quickest at distributing PPE, or the best at testing people. And we'll be able to reach some conclusions about perhaps their system worked really well because of X, and our system didn't work so well because of Y. It's all likely to be highly contested, though. So the pessimistic side of my brain says that people have got a predetermined view of what they want to happen, and therefore will seek the evidence to back it up. As a kind of libertarian kind of person here, like Chris, I'm sort of cheering on Sweden and Belarus and hoping that these countries, obviously I hope every country comes out really well. But do you think there will be an opportunity for a rational reckoning up of how different institutions have performed? And I would say this from the IA perspective. It seems to me the supermarkets have been fantastic at keeping supply lines going. Getting PPE to hospitals through a state-run healthcare system, less impressive.
Yeah, on the narrow point of the supermarkets, first of all, I still can't get any bread flour at a local Waitrose. I think people aren't eating.
Had to be a local Waitrose, didn't it?
Well, we have to pass NASDA on the way. But I think people aren't eating more, so it's not massively surprising to me that after an initial blip, hospitals are coping, whereas obviously a lot more PPE is needed. I think there will be lessons. It'll take a while. There's obviously going to be, these culture wars are going to continue. There's going to be confirmation bias. There are things we know already. It looks like one of the reasons why Germany did so well is because it has excess capacity in its health service, so it was able to create some fever hospitals at a local level, whereas obviously our hospitals became a place where the pandemic just spread. I think we're going to have to get over our myopia of talking about Germany and Sweden and start talking about Hong Kong and Singapore instead, and South Korea. The biggest reckoning that's going to come, and we're going to have to find a way to do this whilst avoiding the Trumpisms in it. I think Donald Trump's been his greatest favour to China was being the one who started attacking them. But we need to start talking about the sources of this. We need to start talking about places where humans come together with live animals and transport systems, because there's got to be some sort of Bretton Woods style agreement where we just start saying that's not how we're going to run it. But it's going to take a lot of data and a lot of understanding, because of, why has Africa not got a massive uncontrollable outbreak? Why are we talking about Britain, for all of its faults, being the worst country in the world in terms of its deaths per million? What is explaining these differences? We're talking about a virus as well as what we do with the virus, and it's got its own natural history that we have to understand.
Chris, what do you think the reckoning up should be, and what do you think it will be? And I see you're inoculating yourself sensibly this evening
You
against
can't be
any
too
risk
careful
of
with your health, Mark.
coronavirus. Yeah. What do you think it? What do you think it should be? What do you think? And I appreciate it's early doors, and Tom's quite right. There's a danger that you kind of leap to a conclusion out of confirmation bias. But are there any early conclusions you can draw about how our institutions have performed? And separate to that, do you think Snowdon-esque conclusions will be the conclusions that are drawn, or are you, as you typically tend to be on the IEA London YouTube channel, a deep, deep pessimist?
Well, the Snowdon-esque and correct conclusions are that Public Health England and the World Health Organization should be shut down and replaced by organizations that actually focus on infectious diseases. Well, one of the reasons we're still in lockdown now is the contact tracing ability of this country, which is apparently pretty pathetic. The mobile phone app doesn't work. That's not Public Health England's fault, to be fair. But Public Health England and their public health teams are in charge of this track and tracing, and they're all saying, "Oh, we're not ready yet." Well, why not? Why not? They've had 3 or 4 months to prepare for this. They've had really years, arguably, to prepare for this, and it's not a particularly difficult job, track and tracing. I know a couple of people who are doing it. None of whom, by the way, have been given any numbers to call. I'm not sure if that's a good or a bad thing. But you get a script, you ring people up, and you try and jog their memory about who they bumped into, and then you get their numbers and you ring them up. It's not rocket science. There's no reason we shouldn't be ready to go with this, but we're not. And one of the reasons I initially supported the lockdown, well, the two of them: one, protect the NHS. I didn't want to see it overwhelmed Italian style, but secondly, because it bought us time to do things like track and trace, which the South Koreans, going back to what Tom says, South Koreans and Singapore and Germans have all done very well, and we haven't. And there's been systematic failures with Public Health England in particular. They were actively advising people against wearing face masks. They were assuring us that they're the very low risk of infection in care homes, incredible stuff, really, and other things, because they've been too busy focused on taking the sugar out of cakes for so long. So I would like to think that's the message people will take. I think probably people will take the exact opposite message. I think that people will blame fat people for coronavirus, and as Boris Johnson has apparently suggested, they will just continue the war on cakes, and there will be a demand for the public health organizations to be given even more money, which they will again spend on trying to take sugar out of cakes.
Well, I want to end on the track and trace technology, and is this going to be the route that will get us out of this problem, and if so, how long will that take? A message which I took seriously actually when I got it on WhatsApp from a friend of mine said, "Dear Mark, if you are contacted by the NHS because you've tested positive and you need to list the people that you have been in contact with in the last 14 days, remember to list the following." And there followed the surnames of the entire Liverpool FC first team, which might have deprived them, I guess, of the championship. But the track and trace thing, joking aside, I mean, this is how it's supposed to work. You get a text message saying, "You've been named as a contact," and that of someone who was tested positive. You're not allowed to know who, and you're meant to then spend a fortnight isolating, and you can't get a test until you've got symptoms. And even if you test negative, you still have to isolate. Tom, what could possibly go wrong? Sounds like a genius system, isn't it? We're just about round the corner to solving everything.
I mean, well, I would, so where track and trace works is South Korea again. And there they take both a more high-tech view on this, but also they're considerably more relaxed about civil liberties. If you're worried about civil liberties on this, imagine being in a country where you can get access to CCTV, to credit card records, to all of these things. And I'm worried that's what we need to do. And to make this work, it's massively ad hoc. You don't really need to list the problems with it, but it's the best we've got. But to make it work, this is why I would say we really don't want to open up now. We currently have 5,600 infections a week. It's unsustainable if each of those has 20 contacts. You're suddenly putting a significant portion of the country in isolation. It'll fail. If we look at what happens when South Korea tried to control its outbreaks using track and trace, it did really well up to patient 31, and then patient 31 created patient 32 through to patient 5,048. And that's the sort of thing that can happen. And that's why we basically need to stamp this out for this to have the slightest chance of working. But yeah, it's not ideal.
Can you just say, though, Tom, a bit more about how and why you think it's worked in South Korea and is coming up against the buffers in the UK? I mean, at least in the early stages.
I mean, it worked. We haven't seen what ours can do, and I want to be fair. It seems to be modelled kind of on the German system. In South Korea, they have a lot more, certainly in China, they have a lot more their ability to go through various digital things, to go through your digital footprint, to find people. We wanted that with the voluntary app, and I'm still not quite sure why the app isn't up and running properly. But it works because you can absolutely blitz outbreaks, because there aren't many outbreaks, and when they are there, chuck everything at them. There was this South Korean nightclub outbreak recently, where they were testing thousands and thousands of people within days. They weren't waiting for a test to come back and then 48 hours and then try to track down who you've met. It's this has to be overwhelming force. And I just don't get the impression that yet we're set up for that. And I think we should be waiting until it's just a little bit better and there's just a few fewer infections.
Paul, is track and trace the way out of this? And if so, how are we doing?
Well, I think it's important, but we've got to remember that the reason it was abandoned in mid-March, I think, was because Public Health England said they could only deal with 5 people at a time or 5 people a day, something absolutely incredible. They weren't set up to do it. We look at, the East Asian governments in general learned from SARS, learned from other viruses and set up the systems to cope with it. See, I've never been able to understand why with the mobile app we just didn't buy South Korean technology. Why did we?
Why can't you just import it?
Yeah. It's absolute madness. That's the gains from trade. Why reinvent the wheel when there's a system there that was already working very well? And so going back to what Tom said, it's not complete. We can't draw firm conclusions from everything, but there are some clear indications that some things work. And the way the East Asian countries have dealt with test and track and trace is the way to go. We know that works, and we copy that. Seems pretty straightforward to me, and I can't understand why our bureaucracy can't do it.
And do you genuinely can't understand why, Paul? Can you hazard a guess? Is it a not invented here syndrome? What is it? I mean, it's just bizarre.
Well, I blame Gordon Brown. I blame Gordon Brown for everything. He inculcated. He got people to think that he could, get rid of risk and solve boom and bust, and he expanded the public sector massively, and bodies like attitudes like Public Health England. And it's that attitude which has to be replaced, instead of focusing on actually doing things and on outcomes rather than tick boxes and this sort of thing. So that would be my guess. It's only a guess.
Okay, I'm going to ask you, gents, to conclude by predicting when. I mean, some of you have indicated this already, but when you would like lockdown to come to an end, by which I mean the full repeal of all of the things included in the Coronavirus Act. When do you actually think we can put this onto the pile of history? When do you think that will happen? And with the limited but growing evidence before you, when do you think it should happen? So there's a kind of political predictive judgment about when it will, but your own judgment about when it should. Chris, let me start with you.
Well, it's a difficult question. I mean, it's a process, isn't it? Even for lockdown skeptics like me. I've got tickets for the Snooker World Championship the first week of August. So you need to get rid of most of the legislation by then. Sat very close together.
For that reason alone.
People are coughing at the best of times. I just want to see the beer gardens open first, then the pubs, and then the snooker halls. I don't know, maybe September perhaps is realistic, but it comes down to this track and trace, and the app's not going to work. The answer to the question, by the way, is that the government wanted to create its own app because it thought it'd be better than everybody else's, and it wanted to use the data. And that's one of the many reasons why people aren't even going to download this thing, even if it works, which it hasn't done so far. So all we've got are the people ringing people up to try and do track and trace. We've got 25,000 of them. We've got 5,000 infections a day. That doesn't seem impossible to me. And if the public health people say, well, we're still not up to it, we need more time, I'm afraid they'll never be up to it. If you're going to wait for people in public health to develop competence to do something, you might as well wait for a vaccine.
Tom, what's your view on the should and the will on the lockdown easing? With the I know all these things uncertain, but
I think September is extremely optimistic. I was invited to talk at a book festival in September on the pandemic, and I sort of replied that I think the chance of the government allowing a bunch of retirees to congregate in a tent in September is pretty low. I mean, the should is when we get a vaccine or realise we're not going to get a vaccine. And the could and the would is precisely that as well. We're going to bump along. The debate between now and then is how much you lift, how much you have to go back down. Track and trace is going to buy us, I don't know, if you talk about R, it's going to buy us maybe 20, 30% of R. So it'll, you know, maybe. So it'll bring 1 down to 0.7 and give us 0.3 to play with. But with 5,000 infections, I don't think 25,000 people can do it. It's just going to spread out of control. So once it's a bit lower, I think we should start lifting various things, with the proviso that come winter, we might discover we have to start reimposing things. This is going to be our life until someone hopefully gets a vaccine.
Oh, you really think it is that long? We're waiting for a vaccine to crack this. We're in this
yeah,
trouble and torment until we can actually kill the virus. We're not managed.
They've been completely clear about this from the beginning. It amazes people. People are surprised by this. This was what Neil Ferguson's that fateful paper. That's what he said in the paper. That's what everyone I've spoken to has been absolutely adamant about. We are not out of this. Our only exit strategy is a vaccine.
Paul, what's your view of the should and the will here?
Well, we can't wait until there's a vaccine because we don't know when that's going to be. You know, we might never get one. And unless we get the economy running something like near normal, there'll be, you know, just massive costs of all sorts. And so we have to move out of it, you know, as quickly as we can. I think that's the government's intention. They're moving as rapidly as they feel they can. And I would say September's a reasonable time. The only thing I'd be cautious about are these, you know, very large gatherings, you know, which do seem to offer the opportunities in terms of the R is an average number, and there's a big distribution within that. And what we want to try and cut off is the ones that are going to infect 10, 20, and 30 people. And, you know, football crowds, let's say the Royal Opera House, are the places where this sort of thing happens, and if we cut those out, we've already made a big impact on R. So apart from that, I would say we'll be back to normal by September.
Okay. Well, I said at the outset that with 3 such rational scientific people, we would knock this whole problem on the head in under an hour. Bad news, I'm afraid. It's taking you 67 minutes, but nevertheless, it's pretty impressive to have knocked the whole problem on the head in 67 minutes in what is such a complex and technical and uncertain area. Some people who've heard me speak before will know the anecdote that I'm about to recount about how it's right to deal with complex, technical and highly controversial matters. And it relates to the great lawyer and statesman F.E. Smith. And when Smith was presenting his first case in court, I believe it was a highly complex, technical, controversial case. And Smith had been speaking for a full hour in his first major court case when the judge said to him, "Smith, I've been listening to you for just over an hour and I'm none the wiser." To which Smith replied, "You may be none the wiser, my lord, but you are assuredly better informed." And so I would like Paul, Tom, Chris to thank you all. I hope we may have made some of our audience today a little bit wiser, but if we haven't made you any the wiser, I hope you're better informed. Stay safe, stay free, have a really good weekend. Please join me next Tuesday, again on the YouTube channel at 6:30 p.m. on Tuesday. I changed from the normal time for my normal Live with Littlewood program. I hope to see as many of you then as possible. If you're able to make a donation to the IEA so we can continue our broadcasting, please do go to our website, iea.org.uk. You can also sign up for our free email daily newsletter there. On YouTube, please hit the subscribe option, the notification bell. And if you've enjoyed this broadcast, please click like and also share it through your own social media platforms. Thank you very much for joining us, Paul, Tom, Chris, it's been a pleasure having you with me this evening. Thanks very much, gentlemen. Have a great weekend. Over and out.